will be discussing non-thermal ultrasound use. Description. These are the buttons essential for non-thermal ultrasound use. Power button, time, intensity, duty cycle, frequency, and the start, pause, and stop buttons. How it works. Ultrasound uses acoustic or sound energy, which creates pressure waves that are transmitted into the underlying tissues and can be used through a thermal and non-thermal effects. Indications for use. Soft tissue shortening, calcific tendinitis, osteoarthritis, rheumatoid arthritis, lateral epicondylitis, subacute or chronic inflammation such as bursitis, carpal tunnel syndrome, trigger points, acute low back pain from prolapsed disc, tendon healing, wound healing, and herpes zoster. Indications for use. Soft tissue shortening, calcific tendinitis, osteoarthritis, rheumatoid arthritis, lateral epicondylitis, subacute and chronic inflammation such as bursitis, carpal tunnel syndrome, trigger points, acute low back pain from prolapsed disc, tendon healing, wound healing, and herpes zoster. Contraindications. Over anesthetic areas, impaired arterial circulation, hemorrhage, over the eyes, over a gravid uterus, cancer local exposure, over the spinal cord after a laminectomy, in the presence of infection, over the carotid sinus or cervical ganglia, over a pacemaker, or with thrombophlebitis. Maintain consistent energy transfer. Concentration of energy at the periosteum can produce burns. Avoid the use of intensities higher than those considered therapeutic. In acute inflammatory pathologies and over the epiphysis of growing bones.
Okay, the first thing that we want to do is you want to examine the patient's skin. Okay, then you're going to turn the machine on. This is the power button. Okay, then you want to press the frequency button, which is right here. And for this purpose, we're going to press it to 3 megahertz. Okay, now we want to press the duty cycle button, which is right here. And for the purpose of this, we're going to choose 10%. Okay, now we're going to press the time button. We want to set it to 1 minute. Okay, now we want to press the intensity button, which is here. And we want to set it to 5. Now we want to apply the medium to his skin. Okay, now we're going to press the start button. It's right here. You want to apply the applicator to his skin, and you want to keep it moving in circular motion so that you don't burn his skin. Okay, after the treatment is finished, you just want to make sure that you clean off the patient's skin.
Suggested occupations. After ultrasound, engage the client in teaching and practice of joint protection techniques for RA, OA, and or back pain during cooking, typing, and laundry. Engage client in leisure activities to provide appropriate range of motion for patients with contractures. Demonstrate tendon gliding exercises for tendon healing. Stretch to decrease pain from trigger points. Documentation. Document the frequency of ultrasound, size of transducer, mode, duty cycle, intensity, duration, frequency of intervention, size and location of treatment area, and all patient responses.